Getting pregnant as a teenager, even if it is planned, often results in adverse outcomes. Compared with women who give birth in their 20s, teen mothers are more often unemployed and quickly become pregnant again. On average, infants of teen mothers also have worse outcomes, including more premature birth and death. Although we know little about how teen pregnancy may vary between individuals with different sexual orientations, a few studies suggest that sexual minority or lesbian, gay, and bisexual teens are more likely than their heterosexual peers to get pregnant. We examined nearly 100,000 participants from the Nurses' Health Study 2 who were teens in the 1970s and early 80s, and their children from the Growing Up Today study who were teens during the late 90s and early 2000s. About 10% of the Nurses' Health Study 2 participants had a teen pregnancy, and that number dropped to 2% among their children. Compared to heterosexuals, nearly all of the sexual minority groups in both of the studies were at an increased risk for teen pregnancy. For example, lesbian participants in the Growing Up Today study had nearly twice as many pregnancies as heterosexuals. Participants who identified as heterosexuals but who also reported having same-sex partners had nearly 6 times as many teen pregnancies as those heterosexuals who didn't report any same-sex partners. We published these results in the American Journal of Obstetrics and Gynecology. The origins of sexual orientation-related teen pregnancy disparities are complex. We know that compared to heterosexuals, sexual minorities more commonly report established risk factors for teen pregnancy. These include having sex at a younger age and not using birth control. Being sexually abused and homeless are 2 other risk factors for teen pregnancy, both of which are more common among sexual minority teens. It's been suggested that sexual minorities may have additional unique risk factors. For example, a young woman might try to avoid the stigma of being a sexual minority by having sex with men. She might even purposely get pregnant to hide her sexual orientation, or she may even use drugs and alcohol as a way to cope with this stigma, which may also lead to a pregnancy. Finally, since sexual orientation topics are frequently excluded from sex education, teens are not being prepared to make healthy choices. Although teen pregnancy rates have declined over the last few decades, in part because of more birth control use, there are still dramatic sexual orientation disparities that have persisted for generations. Healthcare providers and public health practitioners need to be aware of these disparities and develop innovative ways to help sexual minority teens avoid pregnancies.